I'm joined by neurologist Dr. Isaac Mezo. We want to spend a little bit of time talking about strokes. And I guess a good place to start is to remind us what exactly is a stroke.
A stroke is when part of the brain dies, or what we call ischemia. And this happens because there's a lack of oxygen that goes to the brain. Of course, there's many causes of them, and clinically, the way a stroke manifests itself is a person may have a specific deficit, something that's not working well in your body, and that is a sign that something's going on with your brain, most likely a stroke.
Are certain people at higher risk of having a stroke than others?
Absolutely. So, the main risk factors for stroke, number one, besides age, where there's nothing we can do about that, but hypertension. When it's uncontrolled, that is the number one risk factor for stroke, followed closely by smoking, diabetes, and high cholesterol.
So pretty much all those other factors, with the exception of age, one can kind of try to control or take better care of.
That's right. These are called modifiable risk factors because we're able to do something about it, as opposed to the non-modifiable risk factors, meaning age or your family history.
Gotcha. Well, what are some of the warning signs of stroke?
Sure. So, in stroke we use the acronym FAST, F-A-S-T, and that's a pretty good word that can help us think of the signs. F stands for face. That means part of your face may be droopy or numb. A stands for arm. An arm may be numb or weak, not working well. The same thing would be for a leg. S stands for speech. You may be slurring your speech, or you may not be able to get the words out. And then T stands for time, because we know there's a saying in neurology that time is brain, and that means that we have only so much time to be able to do something once you have symptoms for a stroke. So it is very important to get care immediately as soon as you notice these symptoms.
Well, when it comes to those, is it accurate to say that many times a person experiencing them may not even realize it in some instances?
Yes, absolutely. Some people may have a little blurry vision. Some people say, I didn't feel well, and then you may have a stroke. Obviously, it may be a very small one that you don't notice the symptoms. But for the most part, you do notice something. So it's always best to be safe than sorry.
Someone, like a loved one, could maybe see this happening. What should one do if somebody sees somebody maybe in a situation where something needs to be acted upon?
Kevin, many times people say, I felt that I was having a stroke. I took an aspirin, or I said, let me wait until it gets better. Let me lay down, or let me drive myself to the hospital. Not a good idea. The best thing to do is call 911 because, again, time is brain. We need to act upon this stroke fast, and we need to have an accurate diagnosis and not treat something that may not be a stroke.
Sure. Well, and anytime you hear someone say, I'll drive myself to the hospital, that's a situation that could turn even more tragic.
Of course. Anything can happen en route to the hospital. You bet.
Again, emphasize for us, to our listeners, why is it important to act quickly with symptoms or warning signs of a stroke?
Yes, so if you come to the emergency room and we diagnose that you're having a stroke, we have 3 to 4.5 hours to give you a special medicine called alteplase, or TPA, which is a clot-busting medication that could be administered through an IV, and it could dissolve a clot and potentially prevent this stroke from progressing. So it is very important that we have you in the emergency room within certain time, make the accurate diagnosis, and start treating you before that time elapses.
Sure. So again, it's that, can just keep in mind that FAST acronym, and that's pretty much a good indicator of what needs to be done. And is that what happens when someone comes into the emergency room within that time frame? Is that the typical response?
Absolutely. You're going to get a CAT scan right away to make sure that this is indeed a stroke, make sure there's no bleeding in the brain. You're going to get some blood work. We need to exclude any reason why you couldn't get this medication. We need to make sure you're appropriate for this medication. So, yes, we move very quickly. In fact, Morris Hospital is a primary stroke center, and we are equipped to handle conditions like this. We're equipped to be able to act quickly and administer the proper treatment for stroke.
Yeah, and as I understand it, being with Morris Hospital Neurology Specialists, you're kind of leading the charge for the stroke certification.
Yeah, so myself and Dr. Analidis, we are the stroke co-directors, and we have a new neurologist, Dr. Quaynor, who joined us, our nurse practitioner Commissioner Stephanie Henline. We're the neurology team, and we will take care of you if you come to the emergency room.
Awesome. Well, Doctor, thanks for spending some time with us this morning. Certainly appreciate it.
Thank you, Kevin. I appreciate it too.
Dr. Isaac Mezo with the Morris Hospital Neurology Specialist.